Welcome back. With us right now is Dr. Savek Tamorian with Harvard Eye Associates. Sir, it's always good to see you.
Good to see you too. How are you doing?
Great. And we're going to talk about glaucoma today. Coming up in January is Glaucoma Awareness Month, right?
Yeah, and that's probably the most important thing that I can convey to our viewers today is glaucoma is a disease where you don't notice you have it until it's very late. So if you can catch it early, you do so much better.
Okay.
So we're trying to raise awareness. January is Glaucoma Awareness Month. If you haven't had your eyes checked, make sure you get it checked so we can make sure you don't have it.
Okay, so first of all, we're going to put up a slide with a normal eye and one with glaucoma. I know you've talked about this before, but kind of refresh everyone exactly what's happening with glaucoma and why.
Yeah,
why is it happening?
So in glaucoma, what we're trying to do is preserve the fragile nerve in the back part of the eye. That's what relays the information from the eye to the brain. One of the things that can damage the eye is if the eye pressure is too high. That's what glaucoma is. Now there's many different types of it, but ultimately you have pressure that's high, that damages the nerve, and then you lose your vision. Okay. So our job is to catch it early so we can get it taken care of, whether it be with eye drops, laser, or surgery, so that visual impairment doesn't occur. Now the good news here is you can have a fair amount of nerve damage before you actually notice, and that's when we really try to catch our patients. Okay. Because our end goal is maintaining a high quality of life. So if you're not noticing a deficiency, that's great. I'm trying to prevent that for you. Okay, so this is something that would you catch with a normal eye exam, or after maybe a certain age you look at, you add an exam in there? How does that work? You know, glaucoma is actually an umbrella term for over 40 different types, and we have unfortunately babies that are born with glaucoma. Now, usually the way it works here is when you get an annual eye screening, if there's something that looks suspicious, it warrants a couple of additional tests, and that's how we confirm it. So it's a stepwise approach. All right, there's over 40 different kinds? There's over 40 different kinds because there's many different causes why someone's eye pressure would be high. Okay. It then gets further subdivided to two main categories. The takeaway message, though, is the one thing we can do to treat it is to reduce the eye pressure. So we always end up at the same place. How do we bring the eye pressure down? Okay, and how do you do that? There's three ways of doing it, as I mentioned, eye drops, laser, and surgery. Okay. Now the good thing here in glaucoma, we're having a lot of new evolutionary processes occurring that are making the treatment so much better. Up until about 5 years ago, really the only therapy we had was eye drops, and although they work, they can definitely inhibit your quality of life. The revolution that we're seeing is going from a medical disease to more of a procedural disease. So instead of just starting with medications, can we use laser therapy or actually surgical interventions to treat it instead? The trouble we had before is the surgical options we had, they weren't very good options. They were risky procedures to do. Now there's a whole segment of interventions that are coming out that are less risky, that still do a good job. That way we can minimize eye drops. So more of a procedural disease as opposed to just simply using eye drops. Why were the eye drops causing problems? They were just very strong? Were they affecting vision as well? Everyone sort of has a different reason to them. Part of it is cost, part of it is remembering to put it in. And what we forget here, an eye drop is different than a pill. You know, you actually have to physically put an eye drop in. And sometimes this execution can be difficult. Imagine you have glaucoma and there's certain areas in your vision you're not seeing well, but I'm asking you to look over your head and watch a drop go in your eye. That's a challenging thing. Other things that can affect is people can have side effects like redness to the eyes and other issues. It didn't work out well. It worked, but it wasn't great. And we're sort of perfectionists in what we do. We want to see how can we do this better? Again, with the goal of maintaining really good quality of life. And it's just an exciting time that's coming about. 5 years that was occurred, and up in the next 5 to 10 years, we're going to have a lot of great options. Now, I'm looking at this photo here, and am I right? Those are, I should say, the photo on the right. Is that like a little stent or a little drip valve or something put in? Yeah, what you're actually seeing is two stents. Now, this view may look unusual to you because this isn't a view that you see head on. For me to see these structures, there's actually a special lens that we use that takes the light and bounces off a mirror so I can see it. It's a physical property of optics within an eye. But that's actually the view of the drainage system of the eye. So in glaucoma, your eye is making the fluid, and the fluid needs to be drained out. But somewhere in the drainage system, there's a clog. So here are two small little stents that you can put in that'll help release that. Now there's many new, again, surgical interventions that are coming out. This is just one of them that we hope to have approved soon. But each of those stents that you're seeing there is 1/3 of a millimeter. How Itty bitty. They're very tiny.
And where do they drain out to? Is it like tears?
No, it's just to a different compartment within the eye.
Okay.
Think of your eye like a faucet in the drain at in your house. The drain is now clogged. You just simply go underneath it and open it up and just bypass that space.
Okay.
It used to be we had to bypass it totally to a different compartment. Now we just fix exactly where the clog is.
Okay. Are there certain people that are more susceptible to it? And I know I've asked this before, but people who may have diabetes or high blood pressure.
Again, because there's so many different types of glaucoma, the answer is it depends.
Okay.
But the takeaway message is, as you get older, you're more likely to get it. And specific racial groups will have specific disease entities that they're more likely to get to.
Okay.
Diabetes is one of them. That could be one type of glaucoma.
Okay, now getting your eyes examined once a year as you get older, if someone goes in for an eye exam and you look at them, you're going, you know what, everything looks pretty good, except for maybe you need reading glasses or something.
Sure.
Kind of that's. Do you still keep them on that once a year program?
Yeah, generally when you hit about 40 to 50 years or so, you really should be seen about once a year.
Okay.
Again, some of these diseases that come up, you want to catch them early. And if you go more than 1 year in between appointments, you may have some damage before you're caught on the next visit. And let's be realistic. We take care of people so people can live their lives. We don't want to inconvenience them. Sometimes people get busy with things and that appointment gets spaced out a little more than what they want. Next thing you know, oh, I didn't realize it was 2 years since I saw you last. And these are diseases we want to make sure catch. We want you to see well so you can live your life. That's why you're working hard right now.
All right, very good. Great to have you on.
Thank you again for having me. Appreciate it.
Thank you very much. And have a good holiday.
Appreciate it. You too. Thank you again.
And Harvard Eye Associates, you know, they're right over here by the mall area. I say area because we're waiting to see what's going to be happening there. But great folks over there. 951-2020 is the main number, harvardeyeassociates.com. You can find them easily. Always great people. Love to talk with them. Nice to see you, Dr.
Thank you so much. Appreciate it.